Canada saw a steep increase in obesity rates during the COVID-19 pandemic, particularly among young adults. This is according to new research by the Canadian Medical Association Journal. Let's discuss with Dr. Nicola Mercer, the Medical Officer of Health in Wellington-Dufferin-Guelph. Dr. Mercer, thanks for your time as always.
Thanks for having me.
We know that the numbers from this study are fairly alarming. It shows obesity rates rose faster during the pandemic than the prior 11 years. I first just want to get your thoughts on the research and maybe what factors you think led to the increase here.
Well, this is a really interesting study, and because it really validates what I think many of us either know in our personal lives or sort of felt after the pandemic, is that things changed. And one of the things that changed was our eating habits. And I know if you've talked to your friends, a lot of people would say they gained a few COVID pounds. Well, what we did see was that this is now it's documented to be true, and it's much more common in those who are younger. And there's probably a number of factors that really related to this. And so if we think back to the pandemic, it was a very stressful time. We were indoors, we weren't exercising, and importantly, our eating habits changed. And how they changed, which is really interesting, was, we know this from the Guelph Family Health Study, is that people, not only did they eat more, but they ate different foods, and there was a lot more snacking. So we think of ultra-processed foods like French fries and chips and cookies and pop, as well as the use of fast service delivery. So if you want to think of Uber or Skip or any other fast service delivery, this really changed how we were eating, added more calories, and some of these habits haven't changed, which is a little bit worrying.
Yeah, it's so true. You bring up young adults being affected there the most as well. I think it opens the door to ask the question, how can we help youth, especially kids, speak about this without body shaming them?
Yeah, it's a really interesting topic. So one of the things I would encourage, if you are a parent or a grandparent and you have young adults or youth in your life, perhaps start with yourself and think about what you're purchasing and how you're purchasing it. We're actually going into a really good time in Canada. We're going into our fruit and vegetable season. So if you start to look at your grocery cart, look at your weekly food that you're purchasing, are you sort of maybe made a shift to things like a lot more pop than you used to? Are there more cookies, processed snacks, pretzels and chips and things like that in your cart? Or is it an opportunity for you to add more fruits and vegetables? What we eat really does matter, and subtle changes, shifting the amount, especially of ultra-processed food, because they are so calorie dense. You can eat a whack of calories in a bag of chips and still feel full, versus bringing yourself around to perhaps more wholesome eating. That will make a really big difference for your family, as well as help them to adjust to their new eating habits, which will help them for their weight as well as their health moving forward.
Yeah, there's so many different alternatives we can choose for snacks as well. Dr. Mercer, you brought up earlier about those eating habits that we had during the pandemic, and maybe it hasn't exactly changed overall in time. So do you think these results from this study are showing more of a temporary spike, or do you think this is a permanent shift that we're moving towards?
Well, I think for some families it will be permanent, and for some they might want to make a shift. I think one of the things I would encourage people to do is to think about perhaps cooking more at home, and to think of food in three categories. Unprocessed food, which is the food that you look at as it comes from nature, so fruits and vegetables, meat, eggs, fish, they all come, milk, they all come from nature like that. Then there's processed foods, which are still really healthy for you. So you can buy bread, that is processed. You can buy beans in a can, you can buy tuna in a can. Those are processed foods, but they're still healthy for you. And trying to make that shift away from the ultra-processed foods. For families that are able to make that shift, and I do think that there's a movement to people knowing more, what are we putting in our mouths, where does it come from, which country does it come from, what are the ingredients. If you can make those subtle shifts within your own family, some of those shifts will actually be beneficial for your pocketbook, because some foods are quite expensive that are ultra processed, and it will also be better for your health.
Yeah, and I think it's also, that's great advice for when we think of what needs to be done, where we go from here, and when we work towards future prevention as well. Great tips, Dr. Mercer. Thank you so much for your time. Dr. Nicola Mercer, the Medical Officer of Health in Wellington-Dufferin-Guelph. Thanks again.
My pleasure.